2020 forced some tough conversations about the role of urban planning in sowing the seeds of the multiple crises facing the United States. We've been living with a public health crisis, an economic crisis, a housing crisis, and a racial crisis simultaneously for a long time now, long before the novel coronavirus arrived in the United States. In the past year, urban planning has been forced to confront its role in creating these crises. And because of that responsibility, the field now faces the daunting task of becoming part of a sustainable and equitable recovery. In the first days and weeks of the pandemic in the United States, it wasn't clear if there would be time and energy left over for the field of planning to make news or generate debate. Some of that uncertainty had to do with the difficulty of holding public hearings or doing public engagement under stay-at-home orders, but as the weeks and months of the pandemic have passed, planning has proven essential to an understanding of the pandemic and its consequences. So let's take a look at a few of the major themes to emerge from 2020 and the many ways in which ideas and projects of urban planning have intersected with life during the pandemic. Since the early days of the pandemic, the question of whether the density of urban living was an asset or a risk has fueled almost non-stop media commentary. With the coronavirus spreading first and most devastatingly in the city of New York, while leaving rural places relatively untouched, it looked to many in the public and the media like the compactness of human life in the city was responsible for the spread. That fear led many affluent city dwellers to move to less dense locations. Others with the means to do so left because they no longer had to go into the office, or because many of the perks of city living were shut down or closed to all but essential workers. The geography of infection has shifted numerous times, reaching every rural and suburban corner of the country, so density cannot be fairly blamed for spreading the coronavirus. Most of the focus is now on crowding rather than density as a risk for spread. Crowding occurs when multiple households live in a home or an apartment, often due to economic constraints. Crowding is common in expensive cities, creating one of the most obvious and significant connections between urban planning and the public health outcomes of the pandemic. The lack of affordable housing options in many places around the country have made it harder to safely shelter during the pandemic. And many of the people who live in crowded housing arrangements are the same people working essential jobs that can't be done from home. Which brings us to the next big theme to emerge for urban planning during the pandemic: equity. Throughout the pandemic, low-income individuals and communities of color have seen widely disparate infection rates, fatality rates, and economic consequences compared to the general population. These disparate outcomes provided the backdrop for a prolonged period of civil unrest in response to police killings of Black Americans. For planners, the protests and clashes with police that marked most of the spring and summer of 2020 forced some tough but potentially productive discussions about anti-racism. Some innovations in housing and transportation planning have been taken for granted as the right thing to do in pursuit of social and racial good. Black and Indigenous people of color spent much of 2020 raising awareness about how sometimes planning can inadvertently entrench racial disparities despite best intentions. Much of the discussion about racial equity centered on the design and policing of the public realm, and the public realm was where much of the action, from protests to street reconfigurations, occurred in 2020. With so many people staying at home to work and unable to participate in normal activities, much of the year seemed in many places like Carmageddon. In response to the need for more space to exercise, many streets were blocked to all but essential automobile traffic. In other places, restaurants were allowed to operate outdoors on sidewalks and in parking spaces once reserved for cars. The effect has been nothing short of dramatic, and in some cities, like New York City for example, outdoor dining and street closures are likely to become a regular fixture of the city. But all of that change is at risk if people continue to stay away from public transit like they have been during the pandemic, and if more people choose to drive once the pandemic is over. Some evidence suggests a more auto-dependent world is already taking shape, as people move to car-centric locations outside the city and more urban dwellers buy cars. Those are just a few of the biggest lessons and trends to emerge from the pandemic about the ways urban planning decisions can help or hinder public health and economic crises like those facing the world at the beginning of 2021. For more information and tons of links on these subjects and a few others, click on the links below and be sure to subscribe to the Planetizen Courses YouTube channel.